you know that the longest recorded erection lasted for more than 6 months? The poor gentleman who holds this record suffered an injury to his perineum, which affected the blood supply to his penis. And so eventually he needed to have an operation to drain the blood and restore his life to normal. Now, I'm sure no self-respecting man will have the aspiration to have an erection for longer than the time that is necessary to enjoy a good romantic encounter. But it is extremely frustrating and quite embarrassing when the equipment fails or doesn't work according to the plan. And I've had this conversation hundreds of times where a gentleman will sit in my office and he'll say, "Doc, it's taken me a long time. I had to get to know you and trust you before I mentioned this problem. And that is that I'm having erectile problems and I'm super embarrassed about this." So erectile dysfunction can have a major psychological impact. It can be super embarrassing and it can impact relationships, self-esteem, confidence, and it can really impair quality of life. What's quite interesting is that in the course of these conversations, it seems that men feel they are alone. But they are not alone. If you are a man over the age of 40, then the chance that you will have erectile difficulties with your next sexual encounter is around 50%. And if you are over the age of 70, then that statistic increases to above 70%. So erectile dysfunction is actually super common. And so there's really nothing to be ashamed or embarrassed about. The good news is that oftentimes erectile difficulties are related to lifestyle factors, and there are things that you can do to improve your erectile function and therefore improve your sexual health. Let me introduce you to Frank. Frank came to see me because he was having some erectile difficulties. He had lost his wife about 4 years earlier, and now he'd met a charming lady with whom he'd become romantically involved, and he really wanted to please her and to enjoy some good intimate relations. So he said to me, "Doc, things are really not working in the bedroom. What can we do about it?" And so I asked him about his medical history. Frank was taking a number of medications: high blood pressure, cholesterol, and diabetes. He had been a smoker for over 20 years, and he was smoking more than 30 cigarettes a day at that time. He didn't do any exercise. Well, he played golf twice a week, but he used to go on his golf cart around the course instead of walking. When I examined Frank, I found that his blood pressure was a little bit high. He certainly looked quite unfit. He was a bit overweight. He had a little bit of a belly. And his blood circulation was not fantastic. I checked the pulses in his feet, and usually we get good, strong pulses and you can feel the circulation is good. But in Frank's case, it was quite difficult to feel those pulses, and you could see when you pressed on his toes that the blood wasn't coming back as strongly as it should. So he definitely had signs of some impaired blood circulation. When we did his blood tests, we found that he had a very high level of inflammation in his bloodstream. His uric acid was high, and his blood sugar was high, and he had high bad cholesterol and high blood fats. We also tested his testosterone, which is the hormone responsible for libido and everything that relates to manliness. And his testosterone was quite low. So there were a number of biochemical factors that were also at play, reducing his circulation, but also impacting on the normal good hormone balance that is necessary for good sexual function. I explained to Frank that the medicine that we use to treat erectile dysfunction has got limited power. It can certainly help, but if you don't address the underlying causes of the erectile dysfunction, in Frank's case, poor circulation because of his smoking history and because of the medical conditions that he had, as well as the low testosterone level, then it was actually quite unlikely that the medicine for erectile dysfunction would help him that much. He was super motivated to make a change, and so we agreed on the following strategies. I asked him to reduce his smoking, and in fact he stopped overnight. I asked him to consider doing more exercise, and he got a personal trainer 3 days a week to get his blood pumping, to improve his physical fitness, and to improve his overall circulation. Exercise also has a positive impact on testosterone, so physical training would definitely help to boost his testosterone levels. I asked him to follow a low carbohydrate Mediterranean style diet to improve his blood sugar and his uric acid and his cholesterol and his inflammation. And he revolutionized his diet. Plenty of vegetables, very few carbohydrates. If he did eat any grains, they were whole grains, unrefined, good amount of healthy proteins, lots of healthy fats, olive oil, nuts and seeds, fish, seafood. Like I say, he was super motivated. We also CPAP machine for him. So as a side note, Frank had mentioned that his lady friend was complaining that he was snoring. And we did a sleep study which confirmed that he had obstructive sleep apnea. And that was certainly contributing to decreased oxygen supply as well as impacting on his blood circulation and probably his testosterone as well. And so he used a CPAP machine for about 3 to 4 months while he was improving his physical fitness and losing some weight. He didn't need to use the CPAP machine long term because the snoring stopped. Now, with all of these strategies, we found that Frank did not need to rely on any of the medications for erectile dysfunction. Besides the fact that in the bedroom equipment was working better, he felt much better energy, he was enjoying his day-to-day life much more, he was walking the golf course instead of using his golf cart, and his golf game improved significantly. So this case shows that lifestyle intervention can not only improve erectile dysfunction, but it can also have an impact on all the spheres of your quality of life. So just to recap, here are my top 3 tips for changing your lifestyle so that you can improve your erectile function. Number 1, exercise. Make sure that you get some cardio to improve circulation as well as oxygen delivery, and include some resistance training or strength training because that has fantastic effects for testosterone. Number 2, optimize your diet. Make sure that you are eating plenty of fresh produce, vegetables and fruits, nuts, seeds, whole grains. Rather focus on unprocessed whole foods and eliminate processed, deep-fried and foods that contain additives, trans fats, or anything that can be inflammatory. Include lots of healthy proteins, fish, seafood, poultry, eggs, and red meat. All fantastic to improve testosterone as well as your hormone milieu that improves sexual function. And finally, make sure that your sleep quality is good. If you snore, get a sleep study to check for obstructive sleep apnea. And if you have any difficulty sleeping, practice good sleep hygiene to improve your sleep quality and duration, because it's when you sleep that your hormones re-regulate themselves and your body restores its balance. Sleep is also super important for improving inflammation. So these are my top tips for lifestyle improvement for erectile dysfunction.